Director at Human Kinetics and the facilitator for today's presentation. Please just take a few moments to read through some of the housekeeping items on your screen. I encourage you to submit questions throughout the presentation, and we'll address as many as possible during the Q&A session at the end. Also note that the presentation is being recorded, and it'll be available for playback. By the end of the week, you can expect an email containing a link to the recording. Before we begin today, I'd like to hand over the microphone to Paul Branks from the American College of Sports Medicine. Paul will be introducing you to today's speakers.
Well, thank you, Bridget, and good day, everyone. My name is Paul Branks, and I serve as the Vice President of Communications and Media Advocacy for the American College of Sports Medicine based in Indianapolis, Indiana. ACSM is the largest sports medicine and exercise science organization in the world, and we're proud of our partnership with the National Physical Activity Plan Alliance in releasing the 2014 United States Report Card on physical activity for children and youth. And it's my privilege to introduce our two presenters for today's webinar. Dr. Peter Katzmarzyk is chair of the U.S. Report Card Research Advisory Committee and is currently a professor and the Associate Executive Director for Population and Public Health Sciences at the Pennington Biomedical Research Center in Baton Rouge, Louisiana, where he holds the Marie E. Dana Corcoran Endowed Chair in Pediatric Obesity and Diabetes. Dr. Katzmarzyk is an internationally recognized leader in the field of physical activity and obesity epidemiology with a special emphasis on pediatrics and ethnic health disparities. Dr. Russell Pate is chair of the National Physical Activity Plan Alliance and is a professor in the Department of Exercise Science in the Arnold School of Public Health at the University of South Carolina. Dr. Pate is an exercise physiologist with interests in physical activity and physical fitness in children and the health implications of physical activity. His research has been supported by the National Institutes of Health, the U.S. Centers for Disease Control and Prevention, the American Heart Association, and several private foundations and corporations. So thank you for being with us today. We will begin with Dr. Pate.
Well, thank you very much, Paul and Bridget, and let me begin by expressing my appreciation to Human Kinetics and to the American College of Sports Medicine for supporting this webinar, and thanks to everyone for joining the call today. We have a tremendous turnout for the webinar today. And you see listed some of the organizations that are represented. We have over 800 subscribers to the webinar, and we're thrilled that everyone has joined us today for for this activity. So thank you all for joining. I'll begin with a brief overview of the presentation that Peter and I will make over the next few minutes. We'll start with some background on really the basis for the Physical Activity Report Card, comment on the goal of the report card as a project, lay out the framework and methodology that was used, and then report the results of the process that led to the release of the report card, show a summary of the overall findings, and then finish with some recommendations and action strategies that we think are consistent with the findings of the report card. So to begin, as many on the call will know, that in 2008, the U.S. Department of Health and Human Services released the first federally approved physical activity guidelines for Americans, and that document recommends that all American children and youth attain 60 minutes of moderate to vigorous physical activity every day, and within that 60 minutes that they engage regularly in vigorous activity, in bone strengthening activities, and in muscle strengthening activities. So our public health goal is to help all American children meet that standard. The benefits of daily physical activity in children and youth are well documented and were summarized in the Physical Activity Guidelines Advisory Committee report that informed the federal guidelines, and this slide lists the health benefits of physical activity that are well documented in children, and they include higher levels of fitness, improved cardiovascular and metabolic profiles, reduced risk for future development of cardiovascular disease and type 2 diabetes, higher levels of bone health and bone developmental status, higher or improved status in terms of mental health and overall well-being, and improvements in cognitive and academic performance, better motor control, and physical functioning. So the health benefits of physical activity in kids are quite diverse and very important. So the guidelines and the well-documented health benefits of physical activity in kids prompted the development of the 2014 U.S. report card on physical activity for children and youth. And the goal of taking on the process of developing and releasing the report card is to assess the levels of physical activity and sedentary behaviors in American children and youth, as well as the facilitators and barriers for physical activity in kids and related health outcomes. So the basic purpose here is to grade ourselves in the U.S. in terms of the physical activity status of American kids, as well as the status of our communities in terms of supporting physical activity in our kids. The framework that was put together to support the project involved the report card committee, which I'll mention later in the presentation today, assigned letter grades to 10 different indicators that cumulatively reflect how well the U.S. is doing in providing children and youth with opportunities for physical activity and avoidance of excessive sedentary behavior. And together the indicators provide a comprehensive assessment of the physical activity status of American kids. So there are a number of specific indicators that were included in the report card. They include overall physical activity, participation in sedentary behaviors, active transportation, participation in organized sport, active play, health-related physical fitness, peer and family support for physical activity in kids, school-based factors that influence physical activity in our kids, and community and the built environment, as well as government strategies and investments that are being made in promoting physical activity in American kids. Quite a number of different data sources were accessed and applied in developing the report card. They were accessed by the committee that worked with Dr. Katzmarzyk in developing the report card and carefully reviewed as the basis for assigning grades to each of the 10 categories. And this grading system was applied in evaluating our current status in each of the 10 areas, and the grades varied from A to F depending on the percentage of American kids that were seen as meeting an appropriate standard in each of the categories. And as you'll see, incomplete was also one of the scores that could be assigned in cases in which the data were not available to make an assessment and apply a grade. So A to F or incomplete. And with that background and introduction, I'm very pleased now to pass the mic over to my colleague, Dr. Peter Katzmarzyk, who will overview the results of the 2014 report card.
Good afternoon, everyone. It's my pleasure to be here today and to describe to you some of the results in the 2014 report card based on the work of our advisory committee. We're just getting set up here with the transition and transferring over to my slide set. So you should be seeing essentially a slide that says 2014 report card results. And from there, I'll take us through the various indicators and the grades which were assigned. So the first grade we actually assigned was to overall physical activity levels. Our primary indicator in this regard was the proportion of U.S. children and youth who are attaining the guidelines. In other words, 60 or more minutes of moderate to vigorous physical activity on at least 5 days per week. And our primary indicator was derived from NHANES. It was the objectively assessed physical activity by accelerometry. And overall, approximately 25% of kids were meeting the physical activity recommendations. This was corroborated in the 2012 National Youth Fitness Survey results, which were combined with NHANES. And this suggested that, again, 25% of children and youth, this time from self-reported physical activity, were obtaining 60 minutes of moderate to vigorous physical activity every day. We see trends related to both age and to gender, where younger children were more often apt to meet the guidelines than older children. And because of these disparities, we assigned a grade of D-. So based on the objective criteria, we would have assigned a grade of D based on our grading rubric. However, because of the disparities with age and gender, we assigned a grade of D- to this indicator. And this slide just shows some of that from the Health, Behavior, and School-Age Children Survey, showing the well-established trend where males are more apt to meet the guidelines than females across almost every age group and across almost every survey that's ever been conducted on physical activity in the United States. The second indicator we graded was sedentary behavior. And as you're probably aware, sedentary behavior is emerging.
There's something else we could do. And, you know, so we're using the example of the RAND studies that have come out that sort of, you know, and then all the blogs from Al Lewis and
Forgetting.
Right.
Why is this?
Our rants against the field.
I'm sorry, is everyone speakers muted? All the presenters?
Oh, really ranting on this, that's what we've got to, we know we have to get better at this. And so what we're all about now is getting better at this. I mean, I think that's why we've got these 4 big things that we want to do. You know, it's all about getting better at this.
So to that point, Bill, I think we need to figure out a way to say,
I think
when you look at,
computer.
in fact, when you read, I don't know, did you read Ron's article or, you know, the team's article? I thought it was a pretty good article, but it has this flavor of a whining, you know, like, yeah, but it's not that bad, you know. And I don't want to say it's whining, but it's got that flavor.
Paul, can you try leaving the presentation and see if that?
He's got
and that's a bad one.
in his presentation. I'm sorry.
So I'm thinking, you know, to your point, we are about the implementation and making it better. So how can we use our vehicles like this announcement idea and say, you know, yeah, Buchanan, Al Lewis, they've made some valid points. You know, so what do you do about it? Are you going to throw out the baby with the bathwater, or are you going to say there's some real value here? We're saying this.
Okay.
Let's see. All right. Peter, I'm sorry about that. Does that work?
I'm assuming people can hear me again.
Okay. I'm sorry about that, everyone. I'm not sure what happened there.
No problems, no problems. We'll get back on track here now. So as I was just mentioning, we have sedentary behavior as one of the indicators we graded. And as we know, sedentary behavior appears to be a distinct behavior or risk factor for chronic disease, and it's an emerging area of interest. So we don't, at the current time, have guidelines for overall sedentary behavior in children and youth in terms of hours per day of sitting or being sedentary. So our committee relied on screen time as the indicator of sedentary behavior. And according to the American Academy of Pediatrics, that they recommend that children should be limited to no more than 2 hours of quality television viewing or screen time per day. So that was the indicator we used this year for sedentary behavior in lieu of an overall recommendation. So the figure shown on the screen shows that approximately half of children, 53.5%, are meeting the guidelines for sedentary behavior. However, if you look to the right on this figure, we see that there are ethnic disparities where African American children are much less likely to meet the recommendation than our white or Hispanic children. So because of these ethnic disparities, we graded this a D. So sedentary behavior received a grade of D in this year's report card. This slide just breaks it down because when we talk about overall screen time, we're faced with a variety of screens throughout the day, and the committee is struggling with how to document that or how to assess that. Whether handheld screens are the same as computers, are the same as television, and these sorts of things. So this just shows kind of the breakdown, the prevalence of high school students meeting the screen time guidelines for television on the left and for computer use on the right. Now, active transportation is an important opportunity for children to obtain physical activity. School-aged children and youth who travel to school by active means accumulate more physical activity during their day, and they're more likely to meet the physical activity recommendations. So our primary indicator was the percentage of U.S. children and youth who usually walk or bike to school. Now, this is an interesting figure. It shows the change between 1969 and 2009 with respect to the mode of transportation children used to get to school. And if you look at the center of that and you look at the school bus, we see that about 38 to 39% of kids are taking the school bus to school. And that hasn't changed at all over these years. However, what has shifted is the percentage of kids who are walking or bicycling. In 1969, it was about 48%, and this has been reduced to 12.7%. And if you look on the bottom of the graph, we see that this is just a direct reflection of children now being driven to school. It used to be 12% of kids being driven to school by an automobile. Now it's up to 45%. So this real shift we have seen in active transportation has really been due to children being driven to school as opposed to walking or biking. And there's a very strong trend between the distance the children live from school and whether they're more apt to ride their bicycle. 55% of kids who live within a quarter mile of a school are either walking or biking to school. But as you get further away, it drops off quite a bit. So because of this, we graded active transportation an F. Because number one, it's an extremely low percent, 12.7% of kids, and we see this big drop over the last few decades. So moving on to organized sport participation, we realize that data support and demonstrate that youth sports can be a significant contributor to total daily energy expenditure and towards meeting the guidelines. So our primary indicator was the proportion of high school students who are participating on at least one school or community sports team. And the average for the entire population was 58%. So 58% of kids were participating on at least one school sports team. However, we do see this gender disparity where 64% of males on average and 53% of females participate in these school sports. So we have a rather good grade for this. I mean, it's a C minus, compared to the F we gave for active transportation. But again, this gender disparity played into giving a lower grade of C minus. Now, active play is interesting. Our committee felt fairly strongly that we should include active play as an indicator in this report card because active play is really a product of children's natural inclination to be active. And it can take many forms, playing on playground equipment, playing active games with friends at recess, and these sorts of things. And some research suggests that children who are engaged in active play actually accumulate more moderate to vigorous activity than they do during organized events. So, today we kind of organize our children's lives so much and drive them to all the different practices for sports and these sorts of things. But there's some indication that if they were left in an environment which facilitated active play, they may actually be more active. So this was a grade of incomplete this year because we simply don't have data to inform grading this indicator. However, kind of as an indirect kind of indicator, we looked at the percentage of U.S. school districts who require scheduled recess in elementary schools, and we see that this has increased somewhat over time. So this is a positive indication that regularly scheduled recess may be increasing. It's approximately 60% of school districts right now require recess, and recess is one of those opportunities where children can be actively playing. So again, in future years, we hope to have more data to actually provide a grade for active play. Health-related fitness is also an important indicator. Our primary goal here was to assess the proportion of U.S. youth who are meeting physical fitness standards or guidelines. And we adopted the model of Bouchard and Shepard in terms of health-related fitness, which has 5 components. You have your traditional, what you'd think of as physical fitness, cardiorespiratory and muscular fitness, but we've kind of also acknowledged the health effects of physical activity on morphological fitness, so things such as body composition, bone density, flexibility, metabolic fitness, kind of your cardiovascular risk factor milieu, and then we have motor fitness, agility, balance, coordination, and speed of movement. So in an ideal world, we would like to provide a grade which would be comprehensive and which would capture these 5 different components. Unfortunately, at the current time, we don't have data to do that. However, as you're probably aware, the National Youth Physical Activity and Nutrition Survey, we have the National Youth Fitness Survey that was just conducted in 2012 as part of NHANES. These data are currently being released on the website, and the data are slowly being publicly available, and the reports are beginning to come out. So we're very confident that based on the National Youth Fitness Survey, that in future years we're going to be able to provide a grade for health-related fitness. We can draw upon NHANES for the metabolic component and the morphological component, and now with the fitness survey, we now will be able to have data on both cardiorespiratory and muscular fitness. So we're very excited that in future years we will be able to provide grades on health-related fitness. Now, moving on to family and peers, our committee also felt that this was an important area for future work. Parents can support their children's participation by providing direct or logistical support, through behavioral modeling, by providing encouragement, and attending the events and games of their children. So we felt it was important that an indicator of family and peers be included on the report card. However, we currently don't have an indicator, and we don't have any grade to provide. This is another area of emphasis that we hope in future years to be able to provide a grade. The table which I'm showing right now is from the National Youth Physical Activity and Nutrition Study, and it shows the percentage of parents of adolescents and how they've encouraged their children to be active. For example, 73.9% of parents have encouraged their adolescent to participate in physical activity or play sports. 68% provide transportation to sporting events and physical activity venues. 62% watch their adolescents playing sports and doing physical activity. So these are very encouraging numbers. But if you go to the second row of this table, and whether the parents actually play sports or do physical activity with their adolescents, it's only about 48.5%. So they do provide encouragement, they do drive them to sporting events and watch them play. However, they don't tend to be quite as active with them as we might like to see. So again, this year we did not provide a grade for family and peers. However, we feel that in the future, given our current surveillance efforts, that we will be able to provide a grade in this domain. Now, school is another environment which can provide opportunities for children to be physically active, both within physical education and just during the school day itself. But for this year, we chose our primary indicator as the proportion of children who attended at least one physical education class in an average week. Now, I know for us that work in the field that this is a very low threshold, just one PE class in an average week. However, this is what we had to work with available data. And so what we see right now is overall, 51.8% of kids attend at least one physical education class in an average week. So about half of high school students are attending PE. However, there are disparities in this grade. We see the figure on the screen shows that there's a drop between the 9th grade and the 12th grade in terms of participation in PE. And there's a number of reasons for this. One is likely the fact that most school districts don't require physical education in every year of high school. Most high school students can get their PE requirements by the end of 10th grade. And so that's where you tend to see this thing drop off with age. But we also see a disparity in gender. More males than females, and there's about a 10% differential. More males attend physical education than do females. So for these reasons, we gave a C- to the school for physical activity. And of course, in future years, we're going to look at the school environment in greater detail with respect to not just physical education, but how supportive their environments are for physical activity. Now, another interesting area that's emerging in terms of research is the role of the community and the built environment on physical activity levels. So we chose one indicator this year to represent community in the built environment, and that is the proportion of children and youth who live in neighborhoods with at least one park or playground area. And the data from the National Survey of Children's Health show that about 84.6% of kids do live in neighborhoods with at least one park or playground area. However, the 4 bars to the right of that show the prevalence of having a park or playground area in your neighborhood as a reflection of the federal poverty level. So as you move from left to right across this graph, that socioeconomic status increases. So you see a trend where children with higher socioeconomic status, they live in environments with more playgrounds and more parks. We also looked at other data that looked at neighborhood safety, and we also found that there was an even stronger gradient between percentage of the federal poverty level and the safety of neighborhoods. So those with higher socioeconomic status tend to live in safer neighborhoods, and they tend to have more amenities. So for this reason, we gave a grade of B-. In other words, there's an overall high prevalence of having parks. However, what we do see are large socioeconomic gradients in these indicators. Now, we also realize that just having access to a park or playground may not really facilitate physical activity if that playground or park is in disrepair, if it's dangerous to be in the park, if it is poorly lit, or if the park is not connected to the community and the children have difficulty getting there. So next year, or in coming years, we hope to delve deeper into this indicator and provide a more comprehensive assessment of the role of community in built environment and physical activity. Now, moving on to government strategies and investments. This is the final indicator on the report card, and we feel it's important that government be involved at all levels, from municipal to state to federal governments, at helping to increase physical activity levels of children and youth. Now, our primary indicator, however, was mainly focused on the U.S. federal government and what they were doing to enhance opportunities for physical activity among children and youth, looking at both the strategies and the investments. Now, we struggled with providing an actual grade to this year because it's very hard to quantify, and you can't put it on the same benchmark scale like the other indicators. You know, it's not 80% or 60% or whatever. So we provide some examples. Dr. Pate mentioned earlier the 2008 Physical Activity Guidelines for Americans, which represent the first comprehensive evidence-based physical activity guidelines endorsed by the federal government. We have the Community Transformation Grant Program, which supported programs across the country that focused on community health and wellness, including those that promote active living and healthy eating. We have the Federal Safe Routes to School program. This provides funding through the State Departments of Transportation to establish programs and products that make actively commuting to school safe and routine for children and youth. We have the Let's Move campaign. This is a federal program which was launched in 2010. It was introduced and implemented by First Lady Michelle Obama, and its overall mission is to solve the problem of obesity within one generation. Now, it includes both, strategies to increase physical activity and enhance healthy eating. I mentioned earlier the N. Haynes National Youth Fitness Survey. In 2012, this included a nationally representative sample of about 1,500 youth and children living in the U.S., which included direct measurements of physical activity and physical fitness. So this is also a huge investment, we feel, from the federal level. And finally, the President's Council on Fitness, Sports, and Nutrition has a vision that all Americans will lead healthy, active lives. And the President's Council strives to educate and motivate all Americans to live healthy lifestyles. So this is just a few examples of government strategies and investments that we wanted to highlight in our report card. However, as I mentioned, unfortunately, we don't have sufficient evidence to provide an actual grade this year. So just in summary, you'll see that we were able to provide grades to many of the indicators, to 6 of 10 indicators this year. However, we have 3 indicators that remain ungraded. Now, we feel that this is not a weakness. We feel that this is an opportunity. It's an opportunity to obtain more data on these different indicators, such as health-related fitness. I feel very confident that next time we issue the report card, we'll be able to provide a grade for health-related fitness. And we're hoping that it will also spur more research into active play and the role of family and peers in promoting physical activity among children and youth. So that's where we stand for the 2014 report card. And I'd like to turn it now back over to Dr. Pate to discuss some of the recommendations and some of the action strategies moving forward.
Appreciate the leadership. I very much appreciate, Peter, your leadership and the tremendous work that you and your group have done in developing the report card and evaluating a tremendous volume of information and applying the metrics in the manner that you have. I'm very pleased to have the chance now to speak about how we can use findings of the report card to take action that would move us in the direction of scoring better on the report card in the future. And there are two major examples of comprehensive approaches to promoting physical activity that I'm pleased to have the chance to say a bit about this afternoon. One is the National Physical Activity Plan. The National Plan Alliance, of course, was the sponsoring organization for the report card. The National Physical Activity Plan was developed during a 3-year period between 2007 and its release in 2010. And subsequent to the release of the plan, the National Physical Activity Plan Alliance incorporated not-for-profit that now works to nurture the plan has been developed. And throughout its development and since the release of the plan and the Alliance have been guided by a vision, and it is that one day all Americans will be physically active, and they will live, work, and play in environments that facilitate regular physical activity. I'm going to say a bit about the plan, and on this slide you do have the URL for the National Plan website. So if you're not familiar with the plan, I hope you'll take a moment to go to the website physicalactivityplan.org and learn more about it. The plan is organized around 8 societal sectors. They include public health, healthcare, education, transportation, land use, and community design, parks, recreation, fitness, and sports, business and industry, volunteer and nonprofit organizations, and mass media. So the plan is very comprehensive. It also includes over 250 strategies and tactics, and included among them are several that are overarching in nature and span across multiple sectors. And they include launching a grassroots advocacy effort to mobilize support for the implementation of the national plan and the various elements within it. Second strategy is to mount a national physical activity education program, which has not been undertaken up to this point in the U.S. The third is to better disseminate best practices for physical activity promotion. The fourth is to create a national resource center for disseminating tools to promote physical activity. And a fifth is to establish a center to support policy development and policy research across all 8 sectors in the national plan. Very consistent with and complementary to the National Physical Activity Plan and its content is the Design to Move initiative. Design to Move is a physical activity action agenda that is focused on children and adolescents, and it has 2 major foci. One is that we act to create early positive experiences for children. The evidence supporting the belief that these early experiences that children have with various forms of physical activity are very influential in terms of their current and subsequent physical activity behavior and participation later in life. And the second is to integrate physical activity into everyday life. Peter mentioned in going through the report card a number of areas in which our kids are not scoring as well as we need them to in terms of just building physical activity into their day-to-day lives. An example being active transport to and from school. The conclusions from the report card in broad sweep are that we need to take action to increase the physical activity levels of our kids. And concurrent with that, we probably need to take other actions that will have the effect of reducing their sedentary behavior. And the National Physical Activity Plan and Design to Move provide both of them frameworks, complementary frameworks, and lots of specific strategies and tactics that we can undertake to have the effect of promoting activity in kids and hopefully having our kids and our nation as a whole scoring a lot better on future iterations of the report card. If you've not reviewed the report card in detail, I hope you will do that. It's available on the National Physical Activity Plan website, physicalactivityplan.org. And I hope you'll take the time to go there and take a close look at the report card and all the detailed work that Peter's committee has done. The National Physical Activity Plan Alliance would be delighted to have your support. So if you're not already associated with the plan or with an organization that is directly connected to the National Physical Activity Plan Alliance, I hope you'll contact us and let us know if you'd like to be involved. The door is wide open, and I hope that'll happen. Sincerest thanks to not only Peter for a tremendous job in leading the advisory committee that developed the report, but the folks listed here that committed a great deal of time and energy to the process of developing the report card, and we're indebted to them for the tremendous effort that they've given to this project. And I'll conclude by thanking you very much for your participation, for your interest in this topic, and for your support of future efforts to act on the findings of the report card. And of course, I know we all share the sincere desire that in future administrations of this report card, American kids will score a lot better than was the case in the 2014 report, which we've reviewed today. So thank you, and I believe we have some time for questions and responses.
We do, and we've had a lot come in, so I will try to get to as many as possible here. To start, can you answer what percentage of elementary schools have eliminated physical education programs from schools over the past 15 years? Has there been a baseline increase to bring back normative daily activity into schools?
I can provide a response, although I cannot provide a specific answer. It's an interesting and timely question, and I will mention that the National Physical Activity Plan received a request recently from Shelley Foll, who heads up the President's Council at the present time, asking us to provide a review and information regarding the extent to which American kids' exposure to school physical education has changed over time. And we are in the process of working closely with colleagues at CDC in examining some data that are available that will enable us to evaluate that. So I don't have a specific answer to that question right now, but I think we're going to have an answer in the not-distant future. So I encourage keeping an eye on the reports and on the National Plan website, because as soon as this report is done, we'll make it publicly available.
Thank you. An overall physical activity question. Dr. Pate summarized the PAG as 60 minutes per day with 3+ days per week, but Dr. Katzmarzyk presents as 60 minutes at 5 days per week. Is there a reason these comparisons are inconsistent?
It's Peter here. I can answer that, I think. The guideline really is 60 more minutes of moderate to vigorous physical activity every day. This is interpreted differently by different people. It really should be every day of the week. However, when we rely on surveillance data sometimes, we're I guess you'd say, kind of at the behest of who is collecting the data and what definition they used for the physical activity recommendations. So you may see it as physical activity every day of the week, so someone must get 60 minutes 7 full days of the week. Other studies will report just the average. They'll say, on average our children meeting 60 minutes or more per day. So as we move forward with our surveillance systems, hopefully we'll get, kind of more alignment between the actual guidelines and the surveillance data.
Great, thank you. What can youth sport organizations like USA Track and Field and AAU do to further promote youth fitness?
Yeah, I think Peter and I probably both like to comment on this one. I would, and it's an interesting and important question because youth sport is, is a huge institution in the U.S. and millions of American kids are engaged in organized youth sport activities every year. And it certainly is true that kids who are engaged in those programs are in settings where the expectation is that they will be physically active. And we know from some previous studies and some recently published, though, that kids are not always as highly active when they're in those settings as they could be. And so one answer to the question is, in addition to engaging as many kids as possible in youth sport programs, optimize the use of the time while they're there so that all kids who are participating are actually physically active as much of the time as possible while they're in practices and in actual competitive or performance settings with youth sport programs.
Yes, absolutely. I agree with Russ that they need to make the most of the time that the children are there. It's very interesting, the recent studies with accelerometers and time motion studies showing the actual time children are active while participating in organized sports. My comment would be to take a broad view of it and to say that we found significant socioeconomic disparities in organized sport participation. It was those with higher socioeconomic status that had the highest rates of participation in youth sports. They had the ability to not only get their children to the events, like they were able to drive their children around, they were also able to afford, the registration fees and all this, and equipment and all this sort of thing. So in my mind, I think the socioeconomic disparities in organized youth sports needs to be addressed. And that's something that these organizations can play a role in terms of making sure that these organized sport teams are available to a wide segment of the U.S. population.
Thanks. And on that same topic of socioeconomic status, we had a couple questions. One is that Jess thinks it's a very important factor to consider and wonders, has there also been an examination of physical activity in rural versus urban versus suburban environments and the impact of physical activity in children? And then the second question is how safety is determined for the socioeconomic status versus safety of neighborhood status.
I could comment certainly on the second one first, perhaps, and we talked about safety and socioeconomic status. And so from some of the surveys in the National Survey of Children's Health, for example, they ask questions around perceived safety of the neighborhood. And you're able to cross-tabulate that then with the socioeconomic status of the children. And what we found, let me see here, that those with low socioeconomic status, so less than 99% of the federal poverty line, 74% of these children live in what they would call safe neighborhoods. However, when you get to more than 400% of the federal poverty line, we're up to 95%. So that is huge, where 74% of low-income kids are living in safe neighborhoods versus 95% of high-income children living in safe neighborhoods. So these data come from self-report from national surveys, and that's how we're able to kind of cross-tabulate these results. I'm not sure, Russ, if you wanted to handle the first question.
Yeah, I'll try to respond as best I can to the first question, and it has to do with the distinctions between rural and urban. And while I know there has been some research examining differences in physical activity levels between people living in rural versus suburban or urban areas. I'm not aware of studies that have examined those relationships in depth in children and adolescents, and it's possible that there's something that I'm not personally aware of, but and if so, I'll certainly stand corrected. But I would certainly call for a more thorough examination of those issues in the future, because I think that there are very clear distinctions between the settings in terms of physical and social and institutional resources to support physical activity programming in kids across those settings, and there may be particular challenges in rural areas. So I certainly recognize the importance of the question, and I hope we'll learn more about this in the future.
Thank you very much. Dr. Katzmarzyk, Heather says, I know you did some research looking at the contributions of organized sport to daily physical activity. Why do you think these organized sports are somewhat less successful in increasing physical activity when compared to unstructured play? Any thoughts on how we might increase the physical activity obtained from organized sport practices?
Sure. I think Russ talked on this a little bit earlier, that when kids are just actively playing, there are no rules generally, or the kids make up their own rules. And kids have a natural inclination to be physically active if they're given a safe environment, the opportunity to be physically active. Now, and that worked for years and years and years. However, with perceptions of safety, perceptions of crime around every corner, we tend to regulate our children's lives very heavily. And organized sport does play an extremely valuable role in both social development as well as physical activity in children. However, these time and motion studies tend to show that the focus is often on the coaching, which obviously is important. However, the kids are not active most of the time they're being coached, or they're sitting around listening to the coach, or they're waiting their turn to perform a drill, for example, sitting on the sidelines. So there are ways where coaches and parents and volunteers can maybe break up the group and get them, more activity levels into both practice and into game situations, by rotating players and these sorts of things. So, I think the opportunities are there to change the way that's done. But, unfortunately, well, I guess I don't want to say unfortunately, but, there is a certain amount of coaching required and strategy and learning the rules. So obviously that needs to be taken into account. But when you hear about certain sports and kids are saying, oh, I have practicing for 3 hours a day, they're not physically active 3 hours a day. And I think that's fairly clear from the results of recent studies.
This is Russ. I would add just one additional comment, and just to make one specific example. And I think some of the strategies that have been developed and applied in physical education classes also could be applied in youth sports settings. And so, for example, when it is time for kids to be practicing skills, one thing to look for is, are all the kids moving during the period of the practice session dedicated to practicing the skills? So does every kid have a ball or an implement, and are they moving and using that implement during that period of the practice session? Or alternatively, are a lot of kids standing around watching, a small number of kids being engaged in practicing the actual skill? So I think part of the challenge here is to sort of transfer technology that's already there to application in the youth sports setting, where this issue really hasn't been given a high profile in the past.
Thank you. Just a couple questions about the data a little bit. Does any part of the report card contain state-by-state data on youth physical activity? And also, did the organized sport participation indicator include analysis of time spent in non-school youth sport leagues, the ones that are not affiliated with school?
Yeah, I could tackle that. The organized sport participation was asking about at least one school or community sports team. So the child was able to respond to that question, and so we don't know, whether it was a school or a community-led team. So we would have to delve further into the surveillance data to see what the differences are there. I'm not sure of any data offhand for that. And what was the first question?
Let's see. The first question was, I'm sorry, I lost it here.
I have a short memory span.
Oh, does any part of the report card contain state-by-state data on youth physical activity?
Yes. No, it doesn't. This is a national report card. The committee considered doing that, and I think in future years we may do that. However, much of the national surveillance data we relied on is not collected at the state level. For example, NHANES only provides nationally representative data. We do not have data, state by state. So that was one reason we decided not to include that. However, some of the youth risk behavior surveillance system data and the National Survey of Children's Youth, Children's Health, do actually provide state-level data. So for some indicators, we could provide state-level data, and it's our intention to do that in the future. Maybe have a page at the back which provides state-level data, because we're often asked that, and it would be very useful.
Great, and I think we've got time for maybe one or two questions. Do you feel like the transportation issue is related to the times that we live in, as far as children being needed to be driven to school or events because of a rise in crime or just safety issues?
Yeah, this is Russ. I'll be happy to take that one on because I feel strongly about it. As Peter mentioned when he was making the report for this indicator, that there certainly are a lot of kids in our society that live at a considerable distance from the school they attend, and so that is a limitation that is a challenging one. But it's also true that a very large percentage of kids that live within walking distance of their school do not walk or ride bike to school, and so that's not necessarily a physical or at least a distance limitation. Now, I don't doubt at all that there are children that live in neighborhoods where a reasonable person would say there is a safety issue that would preclude their safely walking or riding bike to school. And obviously, as a society, we need to try to address that problem as best we can. But that still leaves a lot of kids that are living in neighborhoods where it would be safe for them to walk or ride bike to school. They live close enough to school to do that, and they're not doing it. And that, I think, signals a huge societal shift over the last few decades, and one that I think we need to address, because that physical activity that kids would get in walking or riding bike to school in the morning and going home in the afternoon can be a major contributor to their meeting the daily physical activity guideline. And of course, the good news is they do it 5 days a week during the school year. So if it's a consistent behavior pattern, that adds up to a lot of physical activity for kids across a year. So I personally think this is an enormously attractive target for us. It's an indicator where we really should be doing better, and there's been a huge social shift in our society over the last few decades that I think we need to address.
Thank you very much. I think that's all we've got time for, unfortunately. Russ, if you wouldn't mind advancing the slide here for just a minute. I just want to thank everyone for joining us today, and thank you to both Russ and Peter for a great presentation. I ask everyone to please take a few moments when your webinar window closes to complete a short survey on today's webinar. We really appreciate your feedback, and it helps us to continually improve our webinars. Within the next couple days, you can expect an email with a link to the recording of today's presentation along with the presentation slides. Feel free to share this link with friends or colleagues. So thanks again for your participation today, everyone, and have a great afternoon.